Tonight, Ontario's vaccine program gets a boost with a new batch of medical manpower.
So excited. I can't believe it's actually happening.
The healthcare pros now able to deliver COVID-19 vaccines, but will they have anything to administer? We'll show you the building anger over delays from the drug manufacturer.
From 2 weeks ago to we're going to contain this thing, we're going to have it taken care of, to everybody has it.
Vaccines too late for some. We'll take you to a Barrie long-term care home where an aggressive COVID outbreak is even shocking public health with how quickly it's spreading. And out with the balmy, in with the bitter. Colette Kennedy tracks a weather forecast that may leave you with chills. Good evening, I'm Chris Glover. In Ontario, pharmacy technicians have been given temporary authorization to administer COVID-19 vaccines, but they need training first, and tonight a batch of them graduated a specialized program. The new inoculation reinforcements come as local officials continue to rail against delays from the vaccine maker. Ali Chiasson gets us started tonight.
I've seen some people.
Today, we're looking at our injection and immunizations training course specifically for pharmacy technicians. At every workstation, they have an injection pad, they have 2 needles. On top of that, they have a vial of sodium chloride solution, and this is what they use to give each other the injection. The students practice on their injection pad, and then there's a final examination where they have to draw up the saline solution in their needle and then effectively give a vaccination, or an injection, I should say, to their partner in order to be licensed to give injections.
And with that, one of the first groups of pharmacy technicians in the province can now start administering the COVID-19 vaccine, like Jennifer Antunes.
I'm a pharmacy technician. I work at Sunnybrook Hospital. Pharmacy technicians cannot do anything clinical.
Until now. The Ontario government passed temporary legislation just a week ago that allows pharmacy techs to help vaccinate the public with the COVID-19 vaccine during the pandemic. The only other province to do so is Nova Scotia.
I will give my first vaccination tomorrow at Sunnybrook.
That's so exciting. How do you feel about it?
So excited. I can't believe it's actually happening.
Excitement amid uncertainty around supply. Deliveries of the Pfizer vaccine will drop by 50% over the next 4 weeks. The delay is being blamed on upgrades to their manufacturing facility as they try to keep up with demand.
This falls solely on Pfizer for letting us down, and this goes right down. Every day we lose, it's a day we've lost in the war.
In the meantime, the province fortifies the front lines with eager pharmacy technicians.
I'm excited that I'm going to get to vaccinate someone that I work with really close with. So it's going to be one of the nephrologists at Sunnybrook Hospital. It shows that he trusts that I already have the knowledge and the ability to do this.
And as soon as we were live, we had an overwhelming demand of pharmacy technicians especially that wanted to be first in line to get the certification so that they can help with the pandemic response and be on the front lines.
If Canada is to reach its goal of vaccinating 13 million people by June, training pharmacy technicians is one way to have all hands on deck. Ali Chiasson, CBC News, Toronto.
Now to Barrie, where a vaccine is too late for many families. A COVID-19 outbreak at a long-term care home there has killed 25 residents. Initial test results are leading scientists to believe a more contagious variant of COVID may have breached the home by a staff member. Lorenda Redicop now with that home's race to contain the contagion.
Burl Taggart's family just found out yesterday she's one of the Roberta Place residents who tested positive. So far, she has no symptoms. Her son is frustrated with the communication.
From 2 weeks ago to we're going to contain this thing, we're going to have it taken care of, to everybody has it. And now it's just this heaving cesspool that's just dare go in there and you're going to get COVID. I don't understand. Clearly, they're overwhelmed. They're not admitting they're overwhelmed. I don't know why, but they need help. They've needed help for 2 weeks, and it's a disaster. And here I am just kind of sitting and waiting.
The health region says in addition to almost all the residents testing positive, 6 cases are very likely connected to one of the more contagious new variants. The first one appears to be in a staff member.
The first case did have a contact, close contact with someone who did travel outside the country. and also who came back and became ill while quarantining.
He says the person had not traveled to one of the 3 countries where the variants originated. The second stage of testing to confirm a variant is expected back in a few days. But he says this outbreak moved way faster than others.
We had upwards of about 55 people becoming ill within 48 hours. This is tremendously rapid.
The Red Cross and a local hospital are among those helping out. They were only able to vaccinate some residents last weekend, only 21.
I could only wish I could turn the clock back. If we had vaccine a month before we went in on Saturday, I think this outbreak would be a lot less severe.
He says staffing is better than earlier in the outbreak, but they have discussed the possibility of extra support from the military.
There's no ceiling of how much help we need because there are just so many things that can happen, staff being infected, staff being off.
The Minister of Long-Term Care says local resources and the Red Cross have so far been the best option.
Is in regular contact with the military to understand what they can provide, to understand the right resources they have, to understand how quickly they can be deployed. We have to make sure we get the necessary resources to these homes immediately.
Jeremy Taggart wants the extra support for his mom and her friends.
I mean, they had the military in the spring. What the hell's going on? Where are they? Like, anything. We need, like, all hands on deck.
Lorenda Redicomp, CBC News, Toronto.
So as you heard in Lorenda's piece there, Barrie officials saying a quicker vaccine rollout could have saved lives at that home. And today, scientists with the Ontario government are looking province-wide. They crunched the numbers to show what the impact would be if the vaccine rollout was accelerated. Angelina King now with that distressing data.
There are about 70,000 people living in long-term care homes in Ontario. About half have been vaccinated for COVID-19. Jennifer Penny's mom wasn't one of them. She died of the virus on Boxing Day before she could get her shot.
It's hard that she's gone and there's a big void in the circumstances of how she left.
Yvette Brock died in a home during an outbreak of nearly 200 cases between staff and residents. Her daughter wishes the vaccine rollout was more efficient.
If she would have had the vaccine, she wouldn't have passed away.
Ontario's COVID-19 Science Advisory Table found if all long-term care residents got their first dose by today, 2,800 cases and 530 deaths would be prevented until the end of March. Compare that to the province's target of vaccinating all residents by February 15th, when 1,200 cases would be prevented and 225 deaths.
I consider this, honestly, to be a breathtaking failure.
Dr. Nathan Stahl says the province deviated from its protocol of prioritizing long-term care since some outside healthcare workers got their shots first.
We had enough supply in our province to vaccinate every long-term care home resident by the end of December 2020, and we have not gotten the job done. But now we're in this situation where we're leaving tens of thousands of long-term care residents vulnerable and tens of thousands of more retirement home residents vulnerable.
And with the supply shortage, people like Dorothy Argent Hoskin are still waiting.
A little disappointing from our point of view. We could sort of see the light at the end of the tunnel, and then, the light went out for a bit.
99-year-old Argent Hoskin was supposed to get the vaccine this week, but her retirement home isn't deemed high risk, so it's been pushed until at least March, a concern for her son when she can't leave her room.
It would just be so nice to have the vaccine and be able to have her sitting downstairs in their, common area and seeing other people.
With the low supply, the advisory table says it would be more beneficial to give long-term care residents first doses rather than administer second doses to healthcare workers outside of the homes. The health ministry says it'll continue vaccinating people inside long-term care and high-risk retirement homes, and says in the coming weeks it'll be able to vaccinate 40,000 people a day. Angelina King, CBC News, Toronto.
In Mississauga, an underground tunnel is the site of a deadly industrial accident tonight. A man in his 30s died shortly after he was pulled out from the tunnel. 3 other workers were rescued with no injuries. It happened near Cawthra and Bloor Street in Mississauga, and emergency crews were called to the scene after 5:30 this evening. The cause of the accident is under investigation and is unknown at this time. In Toronto, an update tonight on the fight to save the Foundry. An injunction has been filed to try to stop the heritage site's demolition by the province.
There is no need for them to expropriate that much land. And especially if we are willing, the city is willing to come to the table and to work with you on exclusive agreements around access and for storage of construction material. You don't need to take it from us. And besides, I think it shouldn't be for sale.
City Councillor Longterm there. Now, on Monday, the provincial government started the demolition of the buildings on Eastern Avenue in the West Don Lands. That caused backlash from some in the local community, the mayor, and other councillors, including Longterm. Last October, the Ford government used a special provincial power to sidestep local planners and public consultation. This new court application for an injunction requests that the court step in and stop the demolition while a different solution is sorted out. Now to major news out of Ottawa, and Governor General Julie Payette is resigning. The move following an independent review into reports of abusive workplace behavior at Rideau Hall. Sources who have been briefed on the review say it is scathing. The review was launched last July after CBC News first reported staff accounts of Julie Payette and her chief secretary belittling, bullying, and openly criticizing employees at Rideau Hall. There are also reports of Payette throwing tantrums. More than 50 people took part in the review, and both Payette and her secretary are now leaving Rideau Hall. In a statement, Julie Payette says she is sorry about the tensions that have arisen at Rideau Hall over the past few months. She says that for the integrity of the office and the good of the country, she has come to the conclusion that a new Governor General should be appointed. Payette also called this an opportune time to resign due to the worsening health of her father. Coming up, the push to get COVID-19 vaccines into Ontario's group homes.
So caregivers who maybe visit nursing homes once in a while are getting shots before actual handicapped people who've been in lockdown since March.
People in congregate living settings like group homes aren't set to get their shots until phase 2. We'll have more on why some say that's not good enough. Plus,
the winds driving snow squalls all the way till tomorrow night. I'm meteorologist Colette Kennedy. I have that, plus your weekend forecast coming up after the break.
Welcome back. Well, the COVID-19 vaccine is being rolled out at long-term care facilities across the province. That is not the case at group homes. Families of those residents say they aren't sure when their loved ones will get the shot. But as Jessica Ng reports, they certainly know the risks of not getting inoculated right away.
This is Christina Kalea. She is spina bifida and lives at Peel Cheshire Group Home in Brampton. As the province's vaccination plan rolls out to long-term care staff and families, Christina's sister Maria is worried.
So caregivers who maybe visit nursing homes once in a while are getting shots before actual handicapped people who've been in lockdown since March.
Christina lives in a congregate living setting with 11 other residents who have physical and or mental disabilities. The Ministry of Health says they're on the list to get the vaccine in March as part of phase 2. Peel Cheshire's executive director, Diane Austin, says that's not good enough.
They're not important to society as far as I'm concerned by what I'm seeing. They're not being considered by government at the moment. We're being left to our own devices, and we just pray to God that we keep COVID out of our building.
It's the same story for residents of group homes in York Region. Additionally, staff here have yet to receive the vaccine. Meanwhile, several of the area's 22 congregate living facilities, like Brown's residential home behind me, have active coronavirus outbreaks.
You know, now we're talking mental health issues, physical ailments, age over 65, and they share bedrooms. So, you know, we're talking, and not all the clients understand social distancing or what COVID's all about.
Putting residents at higher risk of contracting the disease. Disability advocate David Lepovsky says it's all the more reason that they should be put closer to the front of the queue.
People with disabilities disproportionately are getting this disease, are disproportionately getting its hardest or more severe consequences, and disproportionately are dying from it. Yet the provincial government under Doug Ford has not done an effective job in protecting them.
Maria agrees.
It's like another thing that they're sort of at the bottom of the list.
After nearly a year of being apart, she says she just hopes her sister can stay safe until she and her family can be vaccinated. Jessica Ng, CBC News, Toronto.
The city is exploring a new way to deal with 34,000 nonviolent wellness calls to 911 each year. The proposal would create a mobile crisis unit that would not include police. Instead, they would dispatch nurses and mental health workers who are trained to de-escalate issues and provide necessary counseling. Greg Gross has more.
It's something that many in the city say is long overdue.
A new multidisciplinary mobile crisis support service.
Denise Campbell is in charge of a proposal that will be presented to the city's executive committee next week. It calls for a new city-run initiative designed to handle non-violent wellness calls that are currently being directed to police. Under the proposal, those calls would be dispatched to this mobile crisis unit instead.
A team that would include a nurse, a harm reduction and crisis worker, a peer with lived experience of mental health, as well as potentially an elder.
There were renewed calls for police reforms after the murder of George Floyd in the U.S. and the death of Regis Korchinski-Paquette. She fell from her balcony in Toronto after police were called to her home. The plan is to roll out the pilot in just a handful of communities that have higher volumes of these types of calls, including the Jane Finch area and Regent Park.
To work with you to de-escalate the immediate situation. And then I think what's critical is to be able to connect you to community-based services that can help you with either long-term support options as well as, treatment if that's required.
The idea of not seeing that police uniform showing up, does that kind of ease some tension in some of these situations?
I think it definitely could, in terms of some of the anxiety that, young people and other folks face.
Everton Jamie Kane is a program manager at Generation Chosen, a youth group based in the Jane Finch area. He's in favor of this approach, but says it's imperative the city use crisis workers who live or work in the neighborhoods they're being called to.
It can be challenging when you have folks coming out from other areas of the city going into other neighborhoods that they're not necessarily familiar with the socioeconomic barriers and dynamics that exist within those areas.
The proposal will be presented to the Executive Committee on January 27th. It would then have to go before City Council for approval. Greg Ross, CBC News, Toronto.
Looking live outside tonight at Toronto's harbor, and well, I wish I could tell you this warmer than usual weather was here to stay, but that is not the case. The temperature is set to take a dramatic turn, and Colette Kennedy is joining me now. Colette, here we are midway through January, and not a flake of snow to be seen on my walk into work tonight in the downtown.
Thanks, Chris. You know, there's such a contrast between how the grounds look around the city and most of the GTA, and then just a little further north where there's more significant snow on the ground and more coming. Really, all we get out of it is some intermittent flurry activity, but with those winds really ramping up and carrying on, the snow squalls, not just tonight, but tomorrow, all the way to tomorrow night will be in play. Westerly winds turning more northwesterly, so that's going to shift exactly where we have those streamers. But this hasn't changed either. The Arctic air that's coming in for the weekend, it is Arctic air, but it's our overnight lows that are going closer to seasonal. The daytime highs are going to be actually a little below, so they'll be a little bit harder perhaps for us to adjust to, just because we haven't really had that this January. Daytime highs today, boy oh boy, on the mild side, with the exception of the Ottawa Valley there, Ottawa -7. Some of the snow squall watches and warnings in the areas where we have the warning, the pink here. This is where 15 to 25 centimeters, highly localized, but just know you have the whiteout conditions, of course, at times, and so it makes things really poor in terms of the driving conditions. Also a weather advisory just because of that poor travel weather that we have. So you're going to see how these bands kind of shift around. So they were westerly with that northwesterly wind. Now they're going to push over towards the southeast in terms of the areas being affected. At times, some of those flurries come on down to the north shore of Lake Ontario and even over towards the north shore of Lake Erie and into the Niagara region. So we'll have that kind of intermittent, mostly cloudy tomorrow. We could get some breaks with some sunshine in there too, though. That tends to happen when we have these sorts of conditions setting up all the way into tomorrow night. And then we'll start to see those winds backing off a little bit and get into improvement and sunshine, quite a bit of it into Saturday, even though that cooler air is moving in. So that's okay, right? It's the balance. This is what we have for those winds. Mostly look at those arrows and how they shift direction, right? Coming around west and northwest. And that's where we will be seeing those changes with those squalls. Now, with the potential for snow, you see how light it is, just maybe a dusting, if anything, with flurries down here. But what we have here around Owen Sound, Mount Forest, especially in between, that's where you'll see things more significant and getting maybe a little bit of a break at times for you around Parry Sound. But of course, that's been another area of Bracebridge where things have been a little bit tricky too. Overnight tonight, it will feel like -10 Windsor, but the thermometer reads -3, -1 for tomorrow. The temperature actually comes down tomorrow afternoon for London and Sarnia. And for tonight, your readings, enjoy them if you like, the little bit milder air that's in play. Even tomorrow afternoon, the temperatures are okay, up to 0 for Toronto, -1 for Pearson. But there it is. Friday night, Saturday morning, you're going to feel it. And then even those daytime highs, Chris, are running a little below seasonal. So a little bit chillier even in those afternoon hours.
All right, we'll be ready. Thanks, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
All right, coming up, big love for a little dog.
She just has her nasal oxygen lines there. That's how she's getting her oxygen. And that's connected over here to this machine.
An Instagram famous pug fighting for her life gets some help from her loyal fans. We'll have more on the push to save Pickles right after the break. All right, before we go tonight, proof that dog lovers have big hearts and the power of social media. Toronto's own Pickles the Pug is a social media star. She's got about 300,000 followers on Instagram, but an unexpected medical episode has left her fighting for her life.
Hi, Pickles. Oh, hi. She's a little more awake. She's moving her head around, looking at everybody. Pickles.
Oh, and she's still so cute. According to Pickles' owner, she suffered back-to-back seizures on Sunday and was rushed to the emergency vet clinic where she was put into a medically induced coma. Thankfully today she did wake up for a bit, but is still considered to be in critical condition. Her owner put out a plea asking people to donate to help pay Pickles' veterinary bills, and boy did they respond. $32,000 has been raised in just 3 days. Nice to see that generosity, especially during this pandemic. And that is our show for you tonight. Thank you so much for watching. I'll see you back here tomorrow night at 11. Have a great night.